this allows us to talk about the side effects of hormone therapy, right? And we can go through the alphabet of the potential side effects and the prevalence of those side effects. But the reality is, how do you counsel? I know on the PCRI website, they have a weightlifting program, for example, and they can answer some of those questions. But aren't we getting to the point where we know so much about the toxicity of these hormone therapies that if you're not agreeing to do some type of lifestyle change before you go on them, what's the point? You're going to have a really rough ride on a really high, steep roller coaster.
Yeah, let me be more specific. Lifestyle is a nice euphemism, but really the thing that I would say that we have to get people to sign in blood before they take a Lupron shot is a commitment to hire a trainer and go to the, well, now you got to do it at home because you can't go to the gym, but have a trainer come to your house and force you to lift weights 3 times a week to maintain your muscle mass. We know that that's the magic formula for being able to survive low testosterone and have a reasonably normal lifestyle. The men that are unwilling to do that are going to pay a big price with hormone therapy. They talk about instant aging. If you're 60 years old, you're going to feel like you're 75. Achiness, tired, depressed, weak, and it's avoidable. People don't realize that if they can make that commitment and be consistent throughout the low testosterone time, that they can feel pretty darn normal, be pretty happy with their quality of life. But if you compromise, and believe me, even taking a 2 to 4 week holiday, you can be a good boy for 6 months and then go on a trip, stop weightlifting for 3 or 4 weeks, and the muscles disappear overnight. It's shockingly frightening. But so it has to be unremitting, has to be constant, diligent, persistent weight training. And it sounds like a hard thing, but the alternative is even worse. And it's right. So we always spend just as you've given me an opportunity now, we always spend a certain amount of time in our initial consultations, sitting down and having a heart-to-heart about the power of weightlifting.
We live in a use it or lose it world, and that becomes really acute and more important than ever before in prostate cancer when your hormones are manipulated to the point where you are put into male menopause within 30 days. Not over 5 years, not over 3 years, 30 days. Yep. And so what that means is one of my biggest honors, too, besides working this conference, is that the Australian group has published the most papers in this category. So Robert Newton, Nigel Spry, and others. And so we did a review paper a couple of years ago that got just huge amount of downloads. And what they have just continued to show is the clock starts ticking the moment the injection starts, which means the longer that you wait to make lifestyle changes, resistance exercise, upper and lower body, for example, Rebecca, the longer you wait from the moment that injection takes place, it's almost precipitous. The harder it is to get anywhere that you need to go. So if you're already 9 months in or 6 months in, you are so far behind the 8 ball, and that's what they have shown. Yep. They've shown that time matters. So remember we were talking about penile rehab earlier? This is the discussion. The program has to be decided. Okay, you're going to do 2 to 3 days. You're going to do 3 upper body, 3 lower body exercises. You're going to do this for aerobic. This is going to help reduce your fatigue. It's going to help maintain your bones. It's going to prevent sarcopenia, which is age-related muscle loss, which is accelerated from the upper and lower body when this happens. And now what's interestingly enough, they're studying this in women's health in terms of possibly helping even other side effects. Well, we know it potentially helps your mental health because these are very trying times mentally, Yep. And so I love that what you said, because you and I talked about this, that if you're not willing to sign the contract to start before the first injection, man, maybe you should go see somebody else who's willing to take that risk.
It's amazing how people respond. Of course, when we're initially diagnosed with this disease, there's a gravitas about the whole thing. There's a seriousness, and people are receptive. And as long as it's spelled out in uncertain, uncompromising terms that you will do this, I've seen very good uptake. I'd say 75, 80% of people, they really get serious. In fact, some of them get so convinced that even after their hormone therapy stops, they stay on the program for the rest of their lives because they can see the salutary, the sense of well-being that comes about.
People have a tough time understanding, but to put it in these terms, your lean muscle mass is equivalent to essentially your energy levels. So you become a more of a fine-tuned machine. So the greater the amount of lean muscle mass you carry, the potential greater move or change in metabolism. So as you lose lean muscle mass, the idea that you become more fatigued, more lethargic makes complete and total sense. And I know people want to reach toward these elixirs like protein powders, and they want to be the magic man. And maybe those can potentially help to have adequate protein intake. But resistance exercise, now remember, you can do those with weights, or people who are stuck at home can do it with their own body. Remember, a push-up, yoga, these are resistance using the body as its own form of a weight that can still give you a response.